Good evening, everyone. This is Meldita and I'm back here at my YouTube channel, MELDITA'S Info Corner. My Facebook is johnrigacho@yahoo.ca. Okay, so here we go. There are some important points that I have to emphasize. Okay, so if you remember last time, I mentioned that the clean dialysate will come out of the red hose. Well, that is not correct. So here we go. If you see at the bottom of this dialysis here, we have the red and the blue. These are the hoses that, that brings back or brings in dialysate. So the blue hose here will bring in the clean dialysate to the dialyzer. Okay, let's trace the endpoint right here. Okay, because this is the original position now of our dialyzer. Red is up, blue is down. So the clean dialysate will come out of the blue hose, going to this, to the bottom. So the dialysate will travel from the bottom upward. So the clean dialysate from the bottom upward. After the processes of ultrafiltration with transmembrane pressure and diffusion, the clean dialysate will come out here and collected by the red hose. And okay, from the red hose, the dirty dialysate from the red hose, let's trace it again, out here to the red hose and to our sewerage. Okay, so the movement of dialysis in the dialyzer is from the bottom upward. Now, let's talk about also the blood. So the dirty blood is collected from the patient via the arterial line. Okay, so dirty blood comes out here via the arterial line. And this blood, dirty blood, will go to our dialyzer. Let's trace the tubing to this. So this is the red part, the arterial endpoint meeting with the dialyzer. So the dirty blood moves upward, going downward. So it's the opposite. As I have mentioned earlier, the dialysate will move from the bottom upward, but the blood goes upward, downward. Okay, so the dirty blood will pass from the top to the bottom. And of course, the process involved here, as we mentioned earlier, we have the ultrafiltration with the aid of our transmembrane pressure, or the TMP, and the diffusion. So now, we have now a clean, filtered blood here at the bottom, going now to our venous line. So dirty blood from the top, after all those processes, now we have a clean, filtered blood to the bottom. So the venous line will connect the clean blood, okay, we'll trace the tubing, that goes to our drip chamber. So here we go. So the clean filtered blood will pass here via this drip chamber, and air will be out as well. So at the bottom here, we have now a clean, filtered, air-free blood. So this blood will go back to the patient via our venous line. Okay? Going back to the patient. Okay. So, dialysate will move from the bottom upward. Okay? And the blood travels top going downward. Okay. So, they go opposite. Okay. So, and if you see, this is our dialyzer here. If I will get the cross section, this is it. So we have fibers here. I opened it. These are fine fibers. Okay. And then if we do a cross section, these are the fibers here. You see that one here. And each fiber here, we have a membrane around it. So what you see inside the membrane is the blood. Outside the membrane is the dialysate. And we have the membrane around it. Okay. And that's where this process of ultrafiltration with the help of transmembrane pressure and diffusion processes will be involved. Okay. So that's about that. So clean dialysate will come out of the blue hose. Dirty dialysate will go out of the red hose to the sewerage. The movement of the dialysate is from the bottom upward, and the movement of the blood is upward, downward. Okay, so what happens if your patient's blood pressure is low? So let's say you started with a blood pressure systolic of 130, and suddenly you see that the blood pressure is like 100. Well, you will not see yet any symptoms. You don't wait for something to happen for sure. Well, you have to put your patient flat position, and we have to bypass the ultrafiltration, but the diffusion will continue. Now, in the event that these maneuvers fail, then you see that the patient is getting symptomatic, then you start your normal saline bolus. Okay, so you did your first maneuver, flat position, bypass ultrafiltration. Now you're gonna start your normal saline bolus. And to do that, you have to close the clamp of your arterial line. You're not going to suck blood anymore. Your blood pressure is low, so you have to close it. But the venous line remains open because we're gonna return the blood. Okay, so in this case, we're gonna start a normal saline bolus. Okay, so we have to open the clamp. You open the clamp, and then we have to introduce 300 cc's of normal saline to the patient. So what you see is the first one that goes into the patient, the blood. So the blood from the tubing will return to the patient via the venous line. We have like about maybe 350, 400 cc's of blood going back to the patient. It's like 1 unit of blood. And when the tubings got cleared, here comes the bolus of normal saline, which is about 300 cc's. If you see that the patient is okay and effective, our maneuvers are effective after the bolus and everything. If you think he can manage, well, all we have to do is the clamp, the normal saline of 300 cc is over. So we clamp that normal saline tube. We have to close, we have to open, because we have to resume dialysis. So you have to open your arterial line. So you open your clamp, and then you start your dialysis. Well, what if, in the case that a patient seems to be like, you think like the patient might not be capable in spite of our boluses, then you have to make that decision. So in this case, because we had already put back all the blood to the patient, and we were able to give the bolus of 300 cc of normal saline, and we still feel that the patient might not be okay to carry on with the dialysis, then, as I said, you have to finish your dialysis, you got to end up your dialysis, flushes your tubings and everything, and we have to call 911. Okay, that's the best thing to do. Okay, thank you.